sorry I didn't get here sooner, but it's great to see all of you. I have a couple of questions I want to do. I want to start off by talking and asking you to talk with us about the need for a whole of government PPE procurement strategy. And I would say this question will be for you, Ms. Correa. But we talked about the need to protect Americans by ensuring that PPE imported from other countries is legitimate. But counterfeits are only a small fraction of the problem, as you know. Since March, I'm told that hospitals, states, and local governments have reported dire shortages of PPE, and I hear a rising again of those concerns. These shortages have become more acute in recent weeks as cases have shot up, likely contributing to a cycle of even greater demand. As the Chief Procurement Officer at DHS, I assume it would be helpful to you to have a whole-of-government strategy designed to ensure availability of sufficient PPE, including from domestic sources. It seems the President could provide such a strategy, in part by issuing orders to domestic manufacturers to produce PPE under the Defense Production Act. Do you agree that such a coordinated federal strategy would help you to keep, and us, to help us to keep costs down and to ensure quality? And the second half of that question would be, has DHS conveyed the need for such a strategy to the White House, and what has been the response? If you could handle those, I'd appreciate it. Thank you. And again, welcome.
Thank you, sir. Thank you for your question. Certainly, a coordinated procurement strategy is always going to benefit. Anytime that we can bring our resources together, identify the supplies that are needed, and engage our manufacturing entities out there to support that need, it is going to be beneficial to the government, to the state, local, tribal organizations, and all the institutions that serve the public. With respect to a communication of any such strategy or request for such a strategy, I don't have that information. I can certainly check with our officials at DHS who normally communicate with the White House.
All right, thank you. My second question would be for you as well. It deals with sharing COVID-19 test results in public health IT. This pandemic has exposed the cracks in our public health system, and in particular, our antiquated public health IT infrastructure. In too many parts of our country, public health departments are relying on pen and paper. Their fax machines or old incompatible software to collect and share COVID-19 test results. What are DHS and FEMA doing to help update and integrate public health data, such as test results and demographic information in major transit points, such as airports, train stations, and ports? What rules govern acquisition of innovative technologies, and how can we ensure that FEMA and DHS procurement officials have the necessary resources that they need to identify legitimate operators who can help bring our systems into the 21st century?
Sir, I can only answer the question from the perspective of procurement. And as I mentioned earlier, we have several authorities that we want to use and continue using to invite commercial innovative solutions that we can apply throughout our infrastructure, be it for supplies, services, or products. I believe the appropriate officials probably to discuss the IT infrastructure are really our Cybersecurity Information Security Agency, as well as probably the Health and Human Services. But I will certainly take that question back and get you additional information.
Good, and I'll welcome that. A follow-up question to that one, if I can. One of the strengths of Taiwan's public health systems, for example, has been the country's ability to integrate demographic data from travelers with their public health system. What is DHS doing with HHS and with CDC to ensure that domestic and international travelers' COVID-19 test results or symptomatic information such as temperature checks are quickly and accurately collected and shared?
I'm not the appropriate individual because I don't work on the immigration data. I don't know if my colleagues at the team.
Anybody else want to try that? Anybody?
Senator, that's not my area of responsibility within CBP, but we are working with CDC and other agencies as we work on the plan of how we will monitor travelers that we process once we begin to receive more international travelers. Right now, we're about at 5% of where we were last year at this time in terms of international travel. But I will take that question back and make certain that we get you the right answer on what CBP is doing with respect to monitoring travel.
Yeah, thanks so much. Mr. Chairman, there's a company, actually a Delaware company that grew out of DuPont. It's been around for about 30 years, and they operate in, I think, about 90 countries around the world, and a bunch of health-related companies in the U.S. The name is Labware. And what they do, imagine, if you will, a small suitcase that has in it a tablet. That tablet would be used instead of pen and paper to take down the information from people that are about to be tested. And they use their driver's license to actually, as a barcode on the back of our driver's license, to bring down and to unite with the information from the tablet, who this is and what their background is, where they live and everything. And they marries with that the test results. Could be a swab, it could be blood or whatever. Test results, puts it up on the cloud, brings it down to put it in public health agencies across the country. It's really great stuff, and it helps make more accurate information more quickly, and it's actually very helpful, I think, in terms of tracing that sort of thing. So I just lay that at our feet. American technology, Labware.
Thank you, Senator Carper. Now we go back to Senator Cassidy, and if Senator Cardin